Good morning, everyone, and welcome to the Early Childhood Recommendations Panel meeting for the month of June. My name is Cornelia Stevens. I'm Executive Director of Top Early Learning Center, and I have the honor and privilege of serving as the chair of this committee. We would like to thank all of our panel members for serving our Kansas children and families. We are, very, very fortunate to have people who are very committed to the work that happens across the state to benefit those who live here. And we're grateful for your time that you commit to our panel. Today's panel meeting is a remote meeting, and the meeting materials are posted on the panel meetings webpage on the Children's Cabinet website, which is kschildrenscabinet.org. Panel members will clearly identify themselves when they begin to speak, and you can use the raise hand feature to show that you're ready to share if you like. That way, Lindsay and I can make sure that we don't miss anybody that might have some comments. Next slide. So for our agenda, we have our welcome, which I've just done. We'll be approving our June minutes, approving the May meeting minutes. We actually have info for the Kansas Open Forum for today. We will have updates from our All In for Kansas Kids tactic work groups. And so all of our work groups have been preparing final recommendations and/or just kind of wrap up everything that happened for this past year. And we'll give updates on the work that's happened within their groups. We'll have bright spots. And so please, panel members, start thinking now of any bright spots that you would like to share with the work group. So anything happening within your organization, within your community, or that you think would be wonderful for people to know, please be prepared to share information, because I know you have amazing things happening within your community or organization. We'll talk about upcoming meetings, and then we will adjourn. Next slide. So the first thing that we will do is approve the June agenda. So Lindsay did send out the June agenda for all of us to review. May I have if there are no changes, may I have a motion to approve the June agenda as presented?
Saldana Chestnut, I approve the agenda. Move to approve the agenda.
Thank you. May I have a second?
This is Emily Barnes. I second.
Perfect. All those in favor, thumbs up. Very good. Any opposed, same sign. The May minutes were also sent out. Everybody hopefully has had a chance to review the May minutes, and there are no changes to the minutes for the meeting of. If there are no changes to the May minutes, may I have a motion to approve the minutes as presented?
This is Emily Barnes. I move that we approve the May minutes.
And may I have a second?
This is Karen McCrory. I move that I second.
Perfect. All those in favor, thumbs up. Any opposed, same sign. Perfect. Next slide. So each month we do have opportunities for people to present and share information with the panel through the Kansas Open Forum. Kansans are encouraged to submit comments through the Kansas Open Forum comment form, which is on the Children's Cabinet website by 5 p.m. the day preceding each meeting. And you're able to share written comments, or you can sign up to share verbal comments with the panel during this portion of the meeting. This month, we did actually have a comment that was presented. And so it's exciting that we have someone that wants to share information with the panel. And this is from Margaret Nichols. And her comment was that knowing how to read is crucial to all other learning. Children love to sing, and incorporating music as a tool for teaching how to read could help improve school readiness scores. And so this was really just, she wanted to put information out there, just maybe to help us think outside the box. Now, I found this really interesting, only because many of you probably don't know that my undergraduate degree is actually in music therapy. And I started my field as a music therapist in early childhood, working with children who struggled academically, using music to be able to help. And you learn through ABCs through a song, and you still know that song to this day. And so I thought that was just absolutely amazing. Brought back some wonderful memories for me. And so, Margaret, we thank you for maybe giving us some ways to think outside the box in terms of how we are working to address the literacy challenges in Kansas. But we did want to make sure that we shared her comments. And so again, if anybody has any comments that you would like to share with the panel, we will always, make sure that we share the information and then leave it for question or consideration. Anybody have comments or feedback or anything like that regarding Margaret's statement? Okay, if none, thank you again, Margaret, for, I'm sorry.
I was going to say, this is Emily Barnes, and I wanted to thank Margaret for contributing those thoughts. This is an incredibly important thought to consider, and I really appreciate the idea of incorporating music as a tool for teaching. I too have seen the benefit of music in educating our young children. So thank you, Margaret.
No, thank you, Emily, for that. Any other comments? Okay, great. All right, next slide. So now we're going to hear from our work groups. Each work group was given a task 2 months ago to start thinking about any final recommendations to be able to wrap up the work that's happening with the group, and or to maybe kind of lay the groundwork for the next work group that will be kind of taking on this work when our next year begins. This is the last meeting of this year's panel, and most of us will actually be here next year, and so you may still be on the same work group, or you can choose to be on something different. But the work groups did work hard in preparing a summary of the work that they have been doing, and so we're going to start hearing first from Tactics 7.1.2, which is local zoning. And who will be giving that update?
Good morning, this is Tanya with Child Care Rare Kansas, and a couple of us will be jumping in to give this update, but I'm going to start us. So I think you can go to the next slide. Here's everybody that's on our work group, and I won't go through everybody's names, but you can kind of see everybody that kind of helped with this recommendation and everything that we're going to talk about. So our recommendation from our work throughout the year, we got a lot of stuff done this year, so we're excited to be able to show you. We are recommending that the Kansas Children's Cabinet and our state GO team throughout this for the state work together to heavily promote the Community Child Care Support Team webpage, and we'll talk about that towards the end and kind of go through what's on there at the end of this. To organizations across the state, to our active child care programs, to work with their community child care coalitions to make changes to local zoning regulations that are more restrictive to the state regulations. This involves working with their county and city governments when there are child care regulations that go higher than the state regulations. We have tools and items on the Community Child Care Support Center that can help child care community coalitions, child care providers, organizations work to hopefully eliminate those zoning codes or regulations that are more restrictive for state than the state regulations that could be limiting the child care capacity in their city or county. And we have some information on the websites and we found some information where that's happening across the county, and we'll go through what all that looks like. Next slide. Donna, we can't hear you. No. No. We may have to jump in and cover for Aldana, which we can do.
Get real quick here.
Oh, now we can hear you.
Can you hear me now? Okay, super. Crazy. Okay, so basically there's around 85,000 childcare slots across the state of Kansas. So we know that there's a huge need for childcare. And when we started this like 2 years ago, our first focus was on zoning barriers. So we did some surveying and we found out that there really was across the state, and it seemed to be obviously more heavily impacting the larger cities, larger counties such as Johnson, Sedgwick, and et cetera. But we found sporadically, across the state that zoning barriers did impact, especially home providers. There was some impact on center as well, but mainly the zoning impact was on home providers. And some of that was significant. It could be things like requiring a wrought iron fence, which is very expensive. It could be restricting their numbers lower than what state licensing allowed, or restricting the number of vehicles that could be in front of their house. And even with that, just dropping off kids. So we found various things. We also found some cities required additional licenses or permits above and beyond licensing. So there were many instances across the state where zoning barriers could significantly impact childcare providers. And if those were addressed, then they would be able to at least have up to their full capacity, which obviously is going to open up more slots. So that seemed to be a pretty good challenge. And as Tanya said, that was part of the work that we're sure at the end. And the turning the parents, obviously this survey went to providers, so it did not go directly to parents, but we do know its effect. And then the second part that we looked at this year was homeowners associations. So if you want to go to the next slide. So as you can see, I say we did 2 surveys. The first one, again, addressed strictly the zoning barriers. And then the second one that we did this year looked at homeowners associations. So when we started this, we thought that there was no way we could do both in 1 year. So that's why we separated them into 2 years. From our second survey, we didn't get a very good response rate as far as to give you the methodology. So our surveys went out through Child Care Aware of Kansas, was the one sending them out because they have all the contact emails, et cetera, to providers. So that was sent out, I believe, 2 or 3 times to home providers. And this, again, just went to home providers. So our focus was home providers and homeowners associations. We expected a bigger binding, and the fact that we know that, for example, again, in our bigger cities, such as Johnson County, as in Sedgwick County, we know that we've heard those providers talk about homeowners associations being as big a barrier as zoning. But as we delved into it a little bit more, it almost seemed like, again, some of the results, maybe they really were zoning barriers that could be misconstrued as homeowner association barriers. But there are certainly some. However, what with our data didn't show us that homeowner associations were near as big a problem as across the state as the zoning barriers. So that's kind of what, that was our methodology, was surveying providers by email. As you know, sometimes providers just get busy and they just don't have time to answer the survey. So we had hoped for a little bit better outcome. But again, our recommendation focuses back on mainly zoning because that's what our data supports. And I think with that, I'll turn it over to Emily for the last part.
Thank you. So that brings us to action steps. And actually, Lindsay, are you able to click on the link that's in the advertise the completed Child Care Support Center website or webpage? I'd like to take just a brief second to show all of you in here what this webpage actually entails. And it's actually, quite robust. Child Care Aware has been working for many years to ensure that there are good, comprehensive resources available to everyone. And so what we're recommending is that the state of Kansas heavily advertise this website. And Lindsay, if you can scroll down, this page itself has a lot of resources. And if you come to the middle section where resources for tackling childcare challenges together, you can see that there are a couple of different tabs. And one of them, of course, is family-friendly workplaces. You've got childcare support contacts. which has some of the stuff that's been promoted recently. But then you also see that third tab is zoning, and that's part of what was added here. And if you can click on the local codes and ordinances FAQ, the original intention of what we set out to do was to create a toolkit, was our first intention. But then we really became aware of the fact that sometimes toolkits very quickly can become outdated and need to be updated frequently. And so what we opted to do instead was utilize the web page with the ability to come to the FAQ. Much of the FAQ is going to stay decently consistent. And so, we have that, but in the event that it does need to be altered, let's say we have an ordinance that decides that it's time to update, or an area that decides it's time to update their ordinances. And so therefore we can, alter some of the FAQ information. We can edit it and update it. That allows Child Care Aware and the Go team and everything to be able to do that while keeping the access to accurate information seamless and reduce gaps. So if you scroll down through, you can just see, there's a couple of different questions in there, things like, I've been told I have to live in the residence to be able to operate childcare. Well, for, many, many years, that was seen as being a KDHE. People were upset with KDHE until it came to light that this is not a KDHE thing. This is a local ordinance thing. And so being able to talk through, what are the different types of problems people are encountering. If you can go down, there's one about driveways that struck me as I was scrolling through, and I can't even remember exactly where. Oh, there we go. I've been told I need to expand my driveway. Is this a licensing or local? Things like that. It's amazing the different things that people find as barriers in their communities. And so this was a way that, ideally we can offer that information to people. With the success of the various childcare coalitions that are, the regional or the community childcare coalitions that are popping up around the state, they are forming in areas they're able to focus on their own specific needs. This is a tool that we would like to advertise very heavily so that a community can assess their situation, determine the needs that they have, and figure out the best path forward so that they can address the barriers that they feel for their community. Lindsay, can you take me back to the regular slide? And so there's the site. And if you can, I'm good with the website. I can go back to the regular PowerPoint slide to continue. There we go. So the action steps that we would recommend is that, this webpage be advertised, put it in, the Child Kansas magazine, which comes out quarterly. And that way then it's out there. But again, that's kind of a limited reach. Not everybody, if a person doesn't know about Kansas Child, they're not necessarily going to get that. So the other deal is figuring out other ways to promote the web page. And that we came up in our own list. We didn't feel it was necessary to put the list on as a slide, but in our own brainstorming session, we came up with a list of different possibilities, things like making sure that the Kansas chapter of the American Planning Association knows about it, and the League of Municipalities, even making sure KAC happens to know about it. Casito, K-State 105, the different childcare providers, taking the opportunity to ensure that the Early Learning Caucus, the lawmakers, when they meet to learn about early childhood issues, ensuring that this is a topic that is addressed with the Early Learning Caucus. That way they know that this may be happening in their area, and that when they have a constituent reach out to them, that this is a tool that they can use as lawmakers to help address the situation. Looking at, helping promote it in statewide conferences, what's going on with the child care professional development conferences, what's happening with conferences for the support professionals in our early learning field. is this good to, make sure that the Kansas Association of Counties? And so one of the things that we've included in our recommendation is this list of our first list of brainstorm. That way we can ensure that we have a way to get this out, and so that people are aware and able to help get this information to others in the state. Based on the work that we did, we felt that that what we have is reasonably comprehensive, and it addresses the zoning need and gives some clear advice on, or not advice, clearer options on, what to look into, and maybe help a person or a community decide what to do to go forward. Considering the feedback that we got in the surveys about the zoning issues compared to the feedback that we got about the HOA issues, we would recommend that actually this tactic work group not continue in its capacity. We feel that we have fulfilled the mission of what we set out to do. We do have a caveat that we would like the childcare early learning community to be sensitive to this topic, that if we hear it pop back up, if we do hear that people are beginning to voice that HOAs are a big issue, that we be flexible and nimble to respond. And, maybe instead of bringing it back to recommendations panel, we take it to the GO team. But we don't believe that it needs a specific tactic work group to continue the work that we have been doing for the past 2 terms. We would like to see this one close and then take the action steps of advertising and promoting, and then just being sensitive to the likelihood there may be a need that pops back up, and then we take that step at that time. And so that is our recommendation.
Perfect. Thank you all for the group efforts and the sharing the information. It seems like a lot of great work has happened in this group. I was actually attending a childcare meeting here in Wichita where they talked about having to live in the home and that being addressed with our city council and all of that kind of stuff. And so I can definitely see things happening already, with information that's being shared. So does anybody have comments, questions, anything like that for anyone in this work group? Okay, if none, thank you again for the updates and recommendation that we basically kind of fold this and kind of either move on unless it kind of revisits. And so thank you again for that. Next, we will have an update from Tactic 6.1.5, which is recruitment and retention.
Hi, this is Amy Gottschammer, 6.1.5. I apologize, I did not get my slides done in advance. Does anybody want to see them, or did you want the ability to see them in advance before for approval? I don't want to put them up if that's going to step on a toe.
If you want to take the screen share from me and share slides for a little bit, you're welcome to. And then if you want to send them to me later, I'll just incorporate them into what we end up kind of finalizing, if that's okay with you, Cornelia.
Absolutely. Absolutely. I've just got 4 slides. So
great.
Okay, then I will do the screen share here. Okay. Does that
looks good.
Okay, and actually that's just a summary of what 6.1.5 is, so that we are not focusing on compensation at all. Okay, so the main summary of what we have done as of late is that we did go through, after we had completed all of the ideas, the solutions that addressed recruitment and retention, and we threw everything up on a board, brought it all together and tried to organize it into something that made sense. And we decided the best way that we could think to do that was to kind of organize it by audience. Who would be the audience that would most likely use this solution? So we came up with 4 different audiences: direct care providers, state agencies or organizations, advocacy groups, and local coalitions in local communities. So we did create that into roughly a it looks like a spreadsheet, basically a template. And so that toolkit then we decided needed to be available online. So we went to 2 locations to try to decide where we wanted to put that. Would it be better for it to live on the All In for Kansas Kids website, or did it belong at the registry, which is at this point being managed primarily by Casito? So we do have Casito members already on our group. So they were the first people that we talked with about how would this look, who could manage it going forward, who would, who would be updating it, who would be putting the initial data into the website. And so we kind of that. Then we met with Lindsay, Sarah, and Rachel to discuss putting it up on the All In for Kansas Kids website. What would that take? What would that look like going forward? And roughly the All In for Kansas Kids website, as we come to understand it, is really going to be more of a jumping off point for people, not so much that they want to hold everybody's everything, but that they want this to be a place where people can come and then link back to other people's information. So we thought that maybe, given that the registry is not at this point in time up and running, let me get to my next slide. But All In for Kansas Kids is currently up and ready and available, that the first step might be to go ahead, work with Rachel on getting the content to her, getting it up online at All In for Kansas Kids. And then when the registry is available, we can put that information over there, and then the All In for Kansas Kids site becomes a link back to wherever that registry is actually living. I know it's not going to actually live at Casito per se, but wherever that website is hosting it, it would actually live in the registry. So for now, that is kind of what we are looking at. That's the decision we thought made the most sense. We did have one really great suggestion from Rachel, I believe, that it was suggested that we go ahead and add some interactive point on the website where people can enter feedback as they use these suggestions, as they have success with them, that they can enter that into the toolkit and say, yeah, we use this idea. This has saved us. This has kept people in our building, or this has been really successful in bringing new people into our building. Or we tried it and it really wasn't such a big success. Or here's a new idea that isn't even on your toolkit. You should really try this. And that will help us keep it dynamic and moving and gathering new information constantly. So I thought that was an excellent idea, something we definitely want to incorporate it so that it is a constantly moving and new kind of a website. So we definitely want to put that in there. So it will require a little bit of ongoing maintenance because of that. And occasionally because maybe some links might be broken and things like that. But I believe there's software, as I understand, that will catch broken links anyway and bring those to people's attention. So overall, though, the next steps are that we don't believe that 6.1.5 specifically needs to continue as a monthly group that meets. We've done sort of the heavy lift on this. We've done the big research. We've come up with the toolkit. We found a place for it to live. Yes, there's going to be a little more work here at the front end to get that information to Rachel, get it on to the All In for Kansas Kids, and then ultimately when the registry is ready to make that transfer. But in the main, what we were thinking is that perhaps it made sense to merge 6.1.5 with 6.11, maybe into one big group that is just 6.1, just compensation and benefits, and including the recruitment and retention piece. I'm not exactly sure where 6.11 lands with this, and if they think that that's a good idea, but we certainly don't want to just disregard it entirely, but we don't think it needs that specific focus any longer, because we do have this ability now to kind of keep moving forward with it by including this feedback from the community and having this information out there. So the ongoing upkeep of the toolkit can be managed by the staff. We've spoken to both parties. They both have people on staff that there's a position that exists in both staffs that can manage this and manage the upkeep, no matter whether it's on All In for Kansas Kids or the registry site. So that part has been discussed as well. And I believe that's it. So let me stop my share. Did I forget anything, folks, on my team?
If none, Amy, thank you for the overview of everything that is happening. Looking forward to seeing, all of that then move over onto the website when it's all like ready to be shared or whatnot. And definitely like that idea, should 611 continue, of combining the two, that makes sense actually. So, all right. So next we will hear, does anybody have any feedback, comments, et cetera, for Amy or anyone from this work group? Okay, if none, we will hear from strategy 4.2, which is on family-friendly workplaces.
Thank you, Cornelia. This is Dana Book with KCSL, and I guess I get to be the spokesperson again. Full disclosure, I'm a musician. I know how to read. I will not be singing the recommendations today, so take good notes. And thank you to Lindsay for putting this together last minute, because I forgot to send her the slides until yesterday afternoon. So so we are promoting family-friendly workplaces throughout public and private sectors. And as my anxiety and I sat and thought about this morning, and what I was going to present and how we were going to do this, what came to mind is saving the world is hard work, right? It's exhausting. And and what this really is all about, family friendly workplaces, is maybe not so much like a checklist or a worksheet of things that we can do. It's about changing changing communities, changing culture, changing thought processes, and it's daunting at times. So for those of you that feel that, I give you permission to stop and take a breath, which I have to do pretty regularly. So so you see all of us that are involved in this on the group, and believe me, this is truly a group effort. So I appreciate everyone, and we'll hear hopefully from others that are on the meeting today. So next slide, please. So this is really, and I gave Lindsay one slide, so I'll kind of back up and talk about, when I talk about family-friendly workplaces in the community, I always start with defining what that actually is. And I think a lot of us probably think of it as like, how do we achieve work-life balance, right? And all of us, most of us here are employees, and we already know what that feels like, what that looks like for each of us. And so the challenge becomes, how do we get that in front of employers and businesses and keep this conversation going? And it's the work that we do is helping employers understand how effective this is for them, but how also effective it is for the families that are involved, for parents and caregivers of all shapes. I just, my own example, I have one left in the house, and then I have adult children, and then I have an elderly father. And without the support and recognition from my employer, not sure I would be able to juggle all those things at once. So I, again, I talk about my own experiences and what that looks like. So I know what it looks like for me. You all know what it looks like for you. So how do we get that message to employers? And so what it came down to then is really in the needs assessment from 2024, the need for a broader reach of family-friendly workplace policies, and how do we get employers to embrace that. And for several years now, we've had the family-friendly workplace survey that helps employers identify that, and then we resource with guys like me and Brenda and all of us out there doing like specific work around helping businesses put those policies in place. And so the recommendation, what it came down to at this point is encouraging Kansas employers to implement family-friendly policies and practices that strengthen families, businesses, and the Kansas economy. And we have an existing resource through Family Forward Kansas, and it's a guide to family forward workplaces, which is an abundant resource of strategies that businesses can use to address some of those issues that are identified in the survey, which is the second piece of that. So, and for those of you, I'm sure I've talked about it, but the survey that we do is provided at no charge to employers. It is completely anonymous for the employees to take. The the reason it's a little different or a lot different than a lot of the surveys that are out there, we've all seen those where leadership takes this survey about what my employees need, and our tact on this was, when we launched this survey several years ago, was let's talk to the people that are actually being served. Let's find out what they need rather than someone else deciding. And as you know, for the time that I've been in this world, in human services, that's always been a thing that where I've sat in funders meetings, and a lot of very important people decide what other people need. And my response has always been, how come we're not asking them what they need so we can help provide that? And that's really what the survey is about. So again, we provided at no charge. It's anonymous. The other thing that makes the survey different from a lot is that we actually continue on after they get results and provide resources and follow up and support in whatever area is identified in that survey. And it could be, breastfeeding, lactation support, and maternal care. Paid parental leave is a huge thing that comes back in the surveys now, and flexible work scheduling, because the pandemic exposed a lot of things about what that looks like. So that's the recommendation, is that the cabinet encourages employers to implement those policies. And then the actual action steps come down to including that workplace guide that we talked about and the survey on the All In for Kansas Kids website. And then secondarily, helping, kind of serving as a conduit between other state agencies, and other partners. That's you on this call, but unless you work for a state agency, but encouraging those partners and agencies to get involved with this work. And I'll let Carrie speak to the view of the Commerce Department and what that looks like. But as we expand this and grow this and promote this, it's just important to get that out through all channels available. So I think I'm ready for the next slide. I feel like I'm rambling, but yeah, next slide, please. So our recommendation, as far as the continuation of the group, because this work feels really transformational, it takes time, right? And things remain to be done. Supporting the recommendations that were on the previous slide is obviously a huge piece of it, but there's also a component of a social media campaign, which honestly almost, it exists now. We just need to be able to work those channels and work that into true existence. And then kind of refining a designation or recognition piece that would, when a business or an employer implements the survey and policy and practice change and actually proves that they're supporting their employees based on what they've said, then they would earn a designation or recognition of a family-friendly workplace, which then has its own set of what does that look like? Why would I want to do this? And continuing that conversation. So that's where we're at as far as continuing the group. we think it would be beneficial to go another cycle with that. So I think that is the substance of what I have to present to you today. I appreciate that. Open for questions, comments, feedback, thoughts.
And I guess I'll kind of tag on to what Dana was saying a few minutes ago, that finding and coming together on these existing resources has been really kind of a guidance for us to move into the next. And then as we're talking on the committee, that, you know, for us, yes, we have a lot of connections with some businesses across the state, but there are so many other partners out there that should probably be kind of involved in getting the word out about these existing resources, that we're not recreating anything, but really how we can get all types of public-private businesses and involved in this project. So that's kind of where we're building that idea of how else we can bring more to the table to get the word out, to maximize the knowledge about these programs, and then kind of see as we move into that what a designation would fit and be like for businesses to take it to that next level. So that's kind of where we're at on that.
Thank you, Carrie. And other team members, if you have anything to add, it would be super helpful. It's a safe space. It's okay. I saw no one roll their eyes while I was talking, so it's okay. But if not, I understand.
Okay, if none, Dana, thank you so much for the update, sharing info in terms of the work that we've done so far, and especially just in identifying what's already there, right? Why reinvent the wheel? If we have things happening, how do we connect the dots to make sure that people can really access everything that's available? So thank you so much for that. Next, we will have the update from Tactics 6.1.1, which is compensation and benefits.
Morning, this is Heather Schoberger with the Kansas Head Start Association. So as Cornelia just mentioned, 6.1.1 was around increasing compensation and benefits for early childhood care and educational professionals. And I think the next slide is this is just a list of our work group members, so you have an idea of who's been part of this conversation over the past year. Okay. So our focus over the past 12 months has really been around three topics. One, finalizing a working definition of quality compensation and benefits, and I'll share a little bit more about that here in a minute. Also working to determine whether we could identify a benchmark for early childhood compensation as like a base expectation. And then most recently starting to explore potential ideas for increasing access to healthcare coverage for early childhood professionals. So this work group was also active during the 2022-2023 year, and the recommendation that was left was this definition, which said quality workforce compensation and benefits in early childhood education refer to a competitive pay and benefits package that meets the needs of educators, aligns with other professional fields, and ensures continual growth through quality-based metrics and incentivizing professional development. So when our group came together last July, Lindsay, if you want to go to the next slide, we took that recommended definition and feedback that had come in on it, and really looked at redefining it. So we kind of took it apart. We took all the pieces apart, and then we put them back together in a way that we thought would help shape our discussion moving forward. And so what we arrived with was competitive compensation and benefits for Kansas early childhood professionals includes direct compensation and financial relief strategies. And then you can see below we have those further defined, reflective of both experience and credentials, aligned with the broader educational system, tied to a career pathway with opportunities for advancement, and backed by robust and sustainable public and private revenue streams. So really the purpose of that definition was just to help frame and guide our discussion and our work over the next, over the this past year. Lindsay. So we had we initially started out with the goal of trying to identify a benchmark for early childhood compensation. So we looked at several resources. And then as we were in that process, we also joined our conversation with the conversation that was going on around a watershed compensation study. And if you all remember, we had a presentation on that a handful of months ago. The Watershed was engaged by KUCPPR to conduct a study of compensation strategies, and they really mapped kind of big wins, high effort, high impact, low impact strategy that already are in place in other places for increasing compensation. They identified a few big bets, which were setting a compensation base, providing bonuses, and then having increased tax credits for early childhood providers. And so in that report, they identified a potential benchmark compensation-based recommendation of $18 per hour, and they pulled that from a variety of sources that and research that's been done on what kind of average wages are. We can go on to the next one. We also moved our conversation most recently into the healthcare coverage, because we know that that's a real potential barrier for individuals in the early childhood field. And so we've just most recently started to identify some potential strategies to look into further. We have not gone very far with this. It's kind of like where we are at this moment in time, but looking at local Chamber of Commerce group plans and what options there might be for providers there, how are group plans offered by other associations for other fields like medical fields, et cetera. And then is there any potential around state plans for bringing in early childhood providers? Okay, next slide. So where are we as of now? So we don't have a formal recommendation for the cabinet in this area. But we do recommend that that watershed report be shared, likely on the All In for Kansas Kids website, as a resource for others to consider who are also looking at early childhood compensation. And that's one of the things we have really looked at over the past year. There's multiple groups across the state at both the local and state level who are looking at early childhood compensation. So we think that report could be used as a resource to inform some of those local and state conversations and to guide decision-making for those who actually have the ability to direct resources towards compensation, which our work group does not have the ability to do that. But we also want that framed as we don't intend that report to set an expectation for the early childhood field to meet a compensation base without additional resources. So that's been a really big part of our conversation over the past year. We have kind of two ways of thinking about where this work group is now at the end of this panel year. One, we think we've wrapped up the discussion around compensation. So we don't see a need for 6.11 to continue if the focus is going to be solely on compensation. However, if it were to continue, we would recommend that this group focus on continuing to share additional strategies and resources and make those available on the All In for Kansas Kids website, and or focus on a recommendation related to health insurance. Now, I know, Amy, when you presented, you all had some discussion about maybe those two groups would merge. And I think I think I'd safely say on behalf of our group, if that was to be the case, we think that should be really focused on the strategies and resources, and then also the health insurance benefits piece. So that is where we are at this point in time. Anyone want to, oh, Amy?
Sorry. Yeah. So this is Amy Gottchammer. I was just going to say that I think that that would align really well if we do come together, that specifically the health insurance piece, because having that health insurance benefit really helps keep people, in a program, right? I mean, that helps it speaks to retention as well as recruitment. If you can offer that, if you can say we've got this wage and we've got benefits, you're likely, more likely to be able to get somebody to work for you than just saying this is what we pay, but we don't have any benefits. So I think that it speaks to the 6.1.5 focus as well.
Anyone from 6.11 want to add anything that I missed or didn't mention? Okay.
I'm sorry, this is Amy again. Can I ask one more question? The $18 an hour, that benchmark compensation, are you saying that's an entry level wage? Is that what that is supposed to represent?
I don't have that report right in front of me, and I think the report identifies it as a like a goalpost for yes, like a base wage in early childhood.
Okay. All right. So that would be more of an assistant entering in minimal amount of experience,
It's
etc.
not that clearly defined in that study, which is why I think our group feels really strongly that it should be put forth as a resource for informing discussions and not as a formal recommendation.
Fair. Okay. Very good. Thank you.
Fair question, Amy, because I asked the same thing. Okay, so for what position? And because could be a huge jump if it's someone who no experience, but I definitely appreciate Heather having the bullet in there that that this is identified as a resource, and that if there is an expectation that we move to this direction, that additional public resources would be needed to be able to do that. To expect all providers to be able to get there without the additional resources is not realistic. So that's great. Any other questions, comments, thoughts for Heather or the work group? Okay. All right. If none, thank you, Heather, for providing the update. And just to make sure that we are clear in terms of recommendations, we are stating that 7.1.2 is recommending that they end. 4.2 will continue. 6.1.5 and 6.1.1 could end, but potentially could turn into a combined group, but focus on health insurance. And so is that kind of summarizing what everybody stated in terms of their work group presentations? I believe that captured everything. And so we don't necessarily have to make the decision today, but that could be something that we determine when we begin in July, as we talk about work groups or talk about kind of what's going on. That could be a framework, or it could be something we discussed today. Lindsay, do you have a preference on when we make this decision?
Not necessarily. I certainly want to help support the groups, and I'm conscious of wanting for the groups to be able to get started off strong in July, but also noting that the new All In for Kansas Kids strategic plan will go up for approval at the August 2nd Children's Cabinet meeting, and that there might be good information to connect to and pull from when thinking about work groups for the next year for the panel. But everything that you stated, Cornelia, tracks with what my notes shared as well. So I don't know, it's up to the panel. It's up to kind of what everyone wants to do. I feel like potentially taking a summary of some of this information to the first meeting in July, a quick overview and some suggestions, and then maybe starting some conversation with that full group about how they want to enter the year could make sense. I'm rambling. I'm gonna let you take it back.
That's okay. That's okay. I guess my recommendation would be that we not make a decision now. We find out what's going to be in the new strategic plan, because there may be information that's there that's going to help guide that decision and what the work groups could look like. And then since we will have some new members on the panel as well, that we have opportunities then to decide, just as we've done previously, what are the strategies and things that we want to focus on as a panel. And this can continue to be one of them, but we decide then whether or not, if in fact we continue working on compensation benefits, that we merge the two, but that gives us a little more information once we actually have the strategic plan. Is everybody okay with that? Or does anybody feel strongly in some different direction? We don't need a vote, but if you're okay with it, thumbs up. Okay, we got thumbs up. Okay, perfect. Perfect. All right, so next slide, please. Thank you all for your presentations and for the work that we've been doing. It's great to be able to see kind of things wrap up and what the discussions have been. Everybody's had some very meaningful conversations, and so we definitely appreciate the dedication everybody has made to this work. So for our meeting schedule for the 24-25 school year, this is before you, and Lindsay will send out information, and she sends out the little calendar invite so that we all have it on our calendars, and so you'll have that. You can take a screenshot of this, but she'll also send it out to you as well. And with our next panel meeting being on July 19th. Next slide. So bright spots. So everybody was given an opportunity, a heads up in the beginning of our meeting to start thinking about bright spots, about wonderful things that are happening within your organization or your community. And so who has bright spots to share? Who would like to go first? Dana.
Thank you, Cornelia. Dana here again. And so I'm not a huge fan of promoting myself or talking about all the wonderful things I do, but I have been invited to speak and present next month in Montana around some of this work. It's not specifically family-friendly workplaces, but it is about positive experiences and community change and everything. And then I learned this week that I will be going to Atlanta in August to speak at the National Fatherhood Summit, kind of around also the same topics, not specifically family-friendly workplaces, but I always end up talking about that in these presentations. So yeah, I get to run around the country, which is kind of fun.
Well, congratulations. Well
Thank
done.
you.
Melissa.
This is Melissa Martin with Sparkwill. I'm really excited that with the start of the new school year, we will be implementing 2 new early childhood programs in the state. One in Neodesha and another one in Southeast Kansas that I'm not sure is completely public knowledge yet, so I won't call it out, but another one in Southeast Kansas. So we are really excited about the expansion in these communities that have really wanted early childhood programs and not had any through their school districts. So
Excited to learn more and hear about these programs. Very good. Amy.
Yeah, this is Amy Gotchammer. So I just was going to share that we last night we had at my school, Googles of Learning, we had our Superman supper, which is sort of our nod to Father's Day, but more inclusive. We have about 100 kiddos enrolled, and so we invite them to invite all of the important men in their lives. So we had not just dads, but grandfathers and uncles and mom's boyfriend and whoever, the uncle next or the neighbor next door, whoever it is that's actively involved in the raising of these children, and invited them to come and have supper with us. So we provided just burgers and dogs, and we had a photo booth set up with capes and masks, and they all dressed up and got to play superheroes, and we all just had a really, really nice time, and it was just a wonderful event, and the families all really had a great time. So it was fun for everybody, and just something we do every year, but we're still just kind of riding that high. So I thought I'd share.
Very good. Very good. Sounds like a great event. Congrats. Karen?
Yeah. So I was excited to see that for those of us in the area that can apply for Patterson Family Foundation grants, they have a new funding stream coming out to serve childcare needs, and it specifically targets childcare workforce capacity building with training and certification funding. So I'm really excited for those of us who are in the area of Patterson Family Foundation.
Very good. Thank you. And Brenda.
Hello, I'm traveling. I pulled over so I can safely talk to you all. I just wanted to share that next Wednesday? Whatever July 3rd is, we are going to be hosting a roundtable discussion on paid family and medical leave, and that being one of the family-friendly workplace policies that we know is so important for families. I just wanted to invite everyone to join as soon as I get to a safe place, or maybe Lindsay can grab that off of our First 1,000 Days website. But everyone is welcome to join. It is a 45-minute discussion with national and state experts. We're going to have an HR professional with Kansas Society for Human Resource Management also be talking about what it's like to implement that kind of a policy from a business perspective as well. So that is Wednesday, July 3rd from 9 to 9:45. Thanks.
Thank you, Brenda. Drive safely. And Christina.
Yeah, I just wanted to share my school district in Frontenac. We received a preschool development grant a few years ago for kindergarten transitions. And with that money, we put on a future Raider camp where we invited all students, 3 to 5, who would be entering our programs in the next few years to come in, meet kindergarten teachers, and just kind of get acquainted with our school a little earlier. And our school district has found value in it, and they've let us continue that program the last 2 years, even though we didn't have funding. And we just wrapped up our third one, and we had 40 kids enrolled. We had 10 more on the wait list, and we were just really thankful to get that funding initially so we could still continue this.
Very good. Very good. Karen, I see that your hand is up. Did you raise your hand again, or is it just not come down?
Sorry, yes, I just have not lowered it. There you go.
Okay, that's okay. I didn't want to forget you if you had another comment. That's good. Any other bright spots or anything that you would like to share? Okay, if not, if you have ideas of things that you would like to have shared or discussed during our panel, you can actually submit those on the resource form, which is available on the panel SharePoint hub. And Lindsay did send a link to that with the agenda and our meeting minutes. And so again, anytime you have any resources, ideas, you're aware of something that's happening, that would be a really good thing for us to know as a panel. Please make sure that you share that information so that Lindsay can do the work to be able to have that information shared. The next meeting for the Kansas Children's Cabinet and Trust Fund is August 2nd from 9 to noon, and that is going to be live streamed on the Kansas Children's Cabinet YouTube page. Our next early childhood recommendations panel meeting is July 19th. We'll actually have, I believe, 13 new members who will be on the panel during that meeting. And so it'll be exciting as we begin our new year. We give opportunities at the end of each meeting for our work groups to break out and meet again. And I don't know whether or not people want to meet today or not. A lot of people have wrapped up their meetings. And so we will have the breakout rooms open if you want to do that. I don't know whether or not, Lindsay, you want to know now whether anybody's going to meet, or are you just going to leave it open? If anybody wants to meet, then they can. Okay, there you go. And so the breakout rooms will be open. If you would like to meet, then they will be open and available, although again, it's not required. Thank you all again for the dedication and commitment that you've given over the past year to the work of the panel and to Kansas Children and Families. This has been a great group, and definitely love all of the involvement, et cetera, that we've had this year. So I hope that you have a wonderful month of June. I know a lot of people are traveling right now and have new vacations coming up soon or whatever. And so please have a safe month if you're traveling, a good summer if we don't see you back next year. Have a wonderful weekend, and we'll see you soon. Take care. Bye, everyone. We will take a 10-minute break and our work groups can come back at 10:15 if you're going to meet.